Welcome to Jersey Matters. I'm Larry Menti. New Jersey is still suffering through a stubborn opioid crisis, and recently, one county in the state issued an overdose alert. Here to talk about that is Francis Koch, who is the Sussex County Prosecutor. Thank you very much, sir. What does it mean when an overdose alert is released?
It can have multiple meanings. It all depends on what's going on. In Sussex County, we had a pretty significant bump in the number of overdose deaths, suspected overdose deaths, due to substances in January. And because of that, we decided to issue this warning to let the public know about it. And it's also an opportunity not to let them know just about the overdose and the threat that's out there, but also resources for them to be able to obtain.
How many deaths were there in the month?
It's suspected, again, they aren't confirmed yet because of the fact that we need to do final toxicology reports, but 11.
And how many do you normally have?
In 2019, we had 36 deaths, and it all depends each month. This could be an anomaly. In 2019, in June and July, the highs were 6, and the month before, in December, was only 4.
But you average about 3 to 4, so this is a huge increase in 1 month. What does it tell you? How can you react to that?
You react in how you address the issue, how you talk to the public, and actually how responses by law enforcement, it all comes together. What my main concern is that most of these deaths were probably caused by an opioid and probably a mixture with fentanyl. And for those, you know that fentanyl is about 50 to 100 times more powerful than heroin and gets mixed in with opioids. And what we're trying to let the public know is there may be those batches out there, and to be wary. It's a catastrophic epidemic that we're facing, and this is even a greater risk now that it's coming in.
What will that do for an addict, though? I mean, if you tell them there's a bad batch out there, aren't they still going to take it?
They may. Although I think we've made great strides, across the state and even in our county with programs that are going on that people addressing their substance use disorders, they are coming forward. And there are a lot of people, family and friends, who think that maybe it's better not to come out into the light, and they may see this warning, and they may be able to convince their friend, their family member who may have a substance use disorder that it's time to go get help. And to be leery of what you're doing, and maybe it's time to get onto medically assisted treatment, or maybe it's time to go and get help through a recovery.
When you have a jump like this and have to issue an overdose alert, is that an indictment in the way that you've been handling the overdose crisis in your county?
I don't believe so at all. As a matter of fact, I think it shows what we have not had this type of a spike in the past, and we're doing incredible things with the Center of Prevention and Counseling, with law enforcement, our Operation Helping Hand, Clear and Star Report, and I truly believe we're making a huge impact on lives. In fact, on Tuesday night, I went to a naloxone training that was done by the Center of Prevention and Counseling. And it was organized on Saturday, and it was in light of the warning to let people know that they could come to a training and receive free kits of naloxone. And that is a benefit that we're getting that out to the public.
But you've been doing that for a while, right?
Yes, we have.
And then you have this jump, which may be an anomaly, as you pointed out. Then you have this jump. Do you do something different now?
It's just to keep your eyes and ears a little more open of where things are going. We take a look at all of the type of bags that come in with regards to the heroin. And throughout the state, through the drug monitoring initiative, through the state police, each bag or most bags have a stamp on them. And what will happen is we may be able to watch out for certain stamps that may be a heavier in fentanyl percentage than other bags. So we're able to look out for that type of thing.
But this has been the problem, hasn't it? And it's not just your county, it's the entire state, it's many states. But
yeah, it's a countrywide.
Well, I get it. But New Jersey has put a lot of emphasis into this, and ground zero for a while was Ocean County here, and put a lot of emphasis and a lot of money into stopping the opioid crisis. So did the federal government. Other states have shown a decline. New Jersey recently, it went up. And nobody seems to be coming up with the answer for this. Yeah. And so I guess I'm asking maybe an impossible question. What are we not doing?
Yeah, I don't think there is an answer. I don't think there's an answer to any complex problem that faces America. And it took us probably 15 to 20 years to get to where we are. And we're taking the steps to get back and get rid of this epidemic. And I think I understand exactly what you're saying. We have done so much. Why are we still having deaths? And one of the problems was, as this problem and this epidemic started, it started with prescribed opioids in most cases. People then went to heroin. Heroin is less powerful, and it's more expensive to produce than fentanyl for a dealer. Fentanyl came onto the market and became available through dealers. They're getting it from overseas, and it is a lot cheaper, and then people use it. And again, dealers aren't, they're not mixing it in a lab. It's not by chemists. It's being mixed in a powder so you don't get a homogeneous product. And what happens with fentanyl now is you get a product where you may have certain bags that have almost no fentanyl in it, and you'll have people that are using drugs calling their dealer, hey, you gypped me, you didn't even give me anything. No, try another bag. And then the next bag may be the perfect amount of fentanyl. It's the right amount of an opioid to meet the needs of their brain, telling them what they have, what they need. But then the other problem is you have hot spots because it's not mixed, again, homogeneously. So you get spots where there's a concentration of fentanyl, and that one bag kills people. And that's what we're fighting now. I
think a lot of people are frustrated with the crisis because, as you said, it started with prescription drugs.
Yes.
And it was obvious that the pharmaceutical industry, in everything that's been reported, was pushing these drugs early on, and some even apparently lied about the research. And so they look at that, as they did sort of with the financial crisis, saying, why aren't the banks, why aren't they being held accountable?
Well, that is being done now. I know the Attorney General has part of the group that they're looking to sue Purdue Pharmaceutical and going after them. And that's something that needs to be done, but not by a county prosecutor, but that's a statewide action and even a national action that is being looked into and being promoted.
I keep hearing about it, but you don't see it happening. I know the justice system is slow. But
the justice system is as it is, and I can't comment. I'm not party to it, so I don't have the insight any more probably than you do.
But you agree with it in theory?
Yes, there's no question. And with regard to doctors, doctors were lied to for a long time with regard to the effects of these OxyContin in particular, saying that it wasn't addictive. And we've learned that's wholly false. It's incredibly addictive. Maybe one of the most addictive drugs that we've ever seen. And what we did was we created a society of people getting prescription drugs. The average prescription drug was usually like about 30 days.
Right.
And at least some of the studies that I've read and I've gone to conferences, that the average human mind becomes addicted to an opioid in 20 days. Right. So we were taking people that were listening to their doctors and then becoming addicted to the drug.
It's almost like the pharmaceutical company wanted them to get addicted.
I don't know whether they really wanted.
I know you can't figure out somebody's motivation, but it's certainly it's curious that it was 30 days and you get addicted.
And now New Jersey has passed a law that it's a 5-day prescription limitation on a first prescription, which is great. It doesn't mean someone who is has long-term cancer who needs opioids, because opioids are a wonderful drug for people that truly need them. We're not keeping them from people who have those type of diseases, but we're trying to get people who don't need them. My son had an experience with it where he was being prescribed it for a dental procedure, and it just sort of shows how the medical profession has changed back in about 2012, and the doctor said he was going to need them. So being, I guess, a prosecutor's son, he had long talks with me. But then I fast forward 4 years later, and my son didn't take them. But fast forward 4 years later, he had another dental procedure with 4 wisdom teeth coming out. And the doctor gave the exact same talk about how much pain he was going to be in, what could happen. And he said, let's start with Tylenol. And if you need more, you can call me. So it has become, the medical science has gotten to the point now, and the doctors and pharmacists, they understand that it's that important. Let's start at the minimum. And if we have to work up, we will. But let's not just as a default go to opioids.
No, I think awareness is the key. And I do give you credit for issuing this alert and having some transparency, because being aware of the problem is the first step in fixing the problem. And I appreciate you being in here.
Thank you
so much. Francis Koch, Sussex County Prosecutor. Stick around for Jersey Matters and you'll learn about the only wetlands institute in the country, and it's right here in New Jersey.